All right, so we're going to now move to the next part.
So we have three symposium presenters, and they will talk about Quebec-based initiatives and topics. After their presentation, we'll have a 15-minute panel discussion, and you can submit your questions again in the chat. So my first introduction is Jennifer Johnson. Jennifer Johnson is well known, and she's executive director of the Community Health and Social Services Network, so CHSSN, and Quebec Community Health and Social Service Foundation, so QCHF. She has been working on access issues for health and social services for the English-speaking community of Quebec for over 25 years. So welcome, Jennifer.
Thank you for the introduction, Carmen. And I'm so glad to follow Ava's presentation. That was very interesting and links quite a bit to some of the topics that I'm going to be talking about. So I'm just going to share my screen. And if someone can just confirm that you see my presentation in the format of it's full screen and it's not, you're not seeing. Yes. Okay. Carmen is shaking. Yeah. Yes. All good. All right. Yes. Thank you. So language does matter. Absolutely. Oh, wait a second. I have to turn off my translation. Oh dear, it's disappeared more. Translation off. I'm listening to myself in French. That doesn't work. Okay, so language does matter. And it certainly is something that as an organization, CHSSN has been working to raise awareness about and to support English-speaking communities across the province of Quebec to address this issue in their own communities. And today, I'm just going to take an opportunity to tell you about some of the research that's been done recently that you may not be aware of and could be of interest to you and your communities. And it's also a very good example of the importance that the communities place on addressing the issue of barriers to access to services in English. So let me just figure out how to move my, there we go, slide. This is just to sort of place everybody in the right mental context. We believe that language is a health determinant. And it's all about this relationship between language and health outcomes. And Ava's presentation was excellent in illustrating that with regards to how important it is that a patient can communicate and be a part of the health trajectory of their own care. And it's something that drives pretty much everything that we do. The CHSSN works with community organizations across the province of Quebec, and each one of those red dots represents an organization that we work with pretty extensively in the area of health and social services. And with these organizations, we have sort of like a philosophy, a development philosophy that has its roots in the population health approach, health promotion approach. And it has these 5 elements that are critical to addressing the barriers and increasing access to English language health and social services for these communities. The one I'm going to focus on today is the knowledge development. But I wanted you all to see that it's not just about developing the knowledge. There's an important component, many other components that these organizations focus on, and us as well, which would be, developing partnerships with service providers, representing their communities and the community interests with their partners, doing networking to raise the awareness around the needs and challenges of the English-speaking community, and of course, outreach, which links a lot to the patient navigation that Ava was discussing earlier. But it goes beyond that. It's, it's information and referral. It's liaison activities between the community, the service provider. There's a whole gambit of activities that are involved in the outreach component as well. But today I'm just going to focus on the knowledge and the development of knowledge and how important it is for communities to do it, to use it, and to share it with all of the partners that they work with, as well as from my own perspective as a provincial organization, ensuring that all of the provincial players as well have access to this information. So it's all about developing and disseminating an evidence-based research and sharing those best practices with the important partners that you have. So today I'm going to look at 3 different pieces of research that have been done recently that may be of interest to everyone here, and also could just be a good example. The first one I'm going to talk about is barriers to access for men and fathers. It's basically a formula of surveys were done where language data was collected within the survey. So we were able to look at the differences between the linguistic members in the survey, combining that with public data. So this is census information and research that has been done in other areas to develop a portrait of men and fathers in Quebec's English-speaking community and their relationship to services. So we have a partner who's incredibly dynamic. This is the Regroupement pour la Valorisation de la Paternité, RVP. Many of you know them very well because they're extraordinarily dynamic. And we partnered with RVP to ensure that there was a sufficient sample size in 3 surveys that they've done over the past couple of years. So CHSSN was just able to give them the resources they needed to make sure that their sample sizes were valid for English-speaking respondents in their surveys. So in 2018, they did a SOM survey of men in Quebec. The sample size was 2,095, and there were 269 English-speaking respondents in that survey. They did a survey in 2020 on co-parenting, and that had 2,115, of which 228 fathers and 211 mothers were part of the survey. And then this year in 2021, they did a survey on men and fathers and the impact of the pandemic. And there were 2,700 respondents, of which 392 were English speakers. So we had really nice, solid sample sizes within those 3 surveys. The results of those surveys were very interesting, and we gleaned something from each one of them. But we didn't have, aside from having like messages of, yes, English-speaking men were more impacted by the pandemic, we wanted to have something that brought all this information together and developed a portrait of what this research was saying. So there's actually a pôle d'expertise et de recherche en santé et de bien-être des hommes. It's based out of the CIUS Capitale Nationale. And they took this information. They took the 3 surveys. They went out and they did a scan of literature that brought forward the differences in English-speaking men versus the majority population. And they developed a portrait on this. And the principal investigator, Jacques Roy, puts in the beginning of the report, he says, this study was an opportunity to share and reflect between the research community and the the community itself on the results of these surveys and the literature. And in order to use that information concretely to help develop the issues in the health and social services sector. So this is literally hot off the press, and we're doing a presentation of this portrait on February 26th in a webinar format, and it's open to everyone. And I'm encouraging all of you to check out our Facebook page or our website to make sure that you get an invitation to that webinar if it is of interest to you. Because it's very interesting. The results are quite, unfortunately, the English-speaking men have a much higher impact from COVID in terms of psychological distress. And the profile that is presented is very interesting. So I hope that many of you will have an opportunity to attend that event on February 26th. Next is a survey. Is early childhood services. This one's a little different in that it is. I'm presenting to you a series of things that CHSSN has produced, all on the same topic, and maybe soon we will have a portrait developed on all of the research, but we don't have it yet. So we're looking at 5 different pieces of research or analysis that CHSN has been involved in. And here you have the covers of each of those documents, and they're all available on the CHSN website in our document center. From left to right, you have our every I think it's 5 years, the Quebec government surveys with the ISQ, the Institut Statistique du Québec, all children entering kindergarten, and does an analysis of their vulnerability. And when we saw the results of that survey, they had already broken down the results by school board, and we could see the differences between the English school board and the French school board. And we said, oh, we need to look at this in more detail. And so we hired the ISQ to analyze that data via using language variables that were in the survey. So it's basically mother tongue information. So English speaking children, whether they are in French school or English schools systems, compared to French speaking children. Results were really interesting. I'll have a slide to show you shortly on that. We complement that survey with a sociodemographic profile of children aged 0 to 5 and their parents. So we did an analysis of the 2016 survey information, and we have a very interesting sociodemic profile that shows high levels of vulnerability of these groups. Then we did a gender-based analysis of that same information for men and women and mothers and fathers. And that too also showed some very interesting differences between the populations. And I have a couple of no, actually I don't have slides from this one, but it also does have interesting results. And then finally on the right, we did a survey this summer in May and June of English-speaking parents, and we had 1,700 respondents. And I have just a slide or two to show you from that survey as well. So you see, we have this really interesting grouping of research all on the same topic, and it shows interesting vulnerabilities of these populations. In the first study, so this is the Quebec survey of child development in kindergarten. This slide shows you the differences between French-speaking and English-speaking children when looking at the 5 domains of vulnerability analyzed in this study. So you have on the left physical health and well-being, and you have in light blue the French mother tongue, and in dark blue the English mother tongue. And you can see that even with physical health and well-being, 16% of the children surveyed in this survey, English-speaking children, were showing signs of vulnerability in this area versus 9.8. And you can see that it goes across the board that English-speaking children show a higher level of vulnerability in each of the five main categories. And when you look at the far right column, in at least one domain, you can see that one out of 3 children versus 1 out of 4 children, or are showing levels of vulnerability in at least one domain of these vulnerability indicators. So social competence, emotional maturity, cognitive and language development, and communication skills. And so this is a very interesting indicator of the fact that English-speaking children are actually showing higher levels of vulnerability when they arrive in kindergarten. Of course, the study, there's a lot more in that study that shows some of the questions we looked at in terms of trying to help explain why, but we never really get a very clear understanding as to why in that survey. And in an effort to look at maybe explaining some of these differences, the survey we did this summer asked parents themselves about some of the barriers that they're experiencing. Here you see, how important is it to you that the following be offered in English? And here we're talking about specialized services. So this is like language development, emotional difficulties, neurological challenges, autism, ADD, physical disabilities, etc. And 98% of parents are saying, yes, they would like to have those services available in English. Early childhood activities, 97%. Parenting support, 97%. So parents are obviously saying that these types of services, they want to be able to serve, to have them in English. But when you look at was it difficult to find the following services in English when you wanted them? You're looking at, 80%, 73%, 74%, 67%, all saying that yes, this was difficult to find. And of course, our results vary depending upon the region that they're located in. As Eva mentioned in her presentation, the off-island versus on-island reality is definitely um, shows differences between the ability to access services in English. And what we're trying to do with these resources is we're trying to build an argument, the reasoning, the logic to improve access to early childhood services for our community. And we've developed a framework to help promote improving access to these early child care services. And you can see, the the desired outcome is to improve access to quality and inclusive early learning. Sorry. In childcare programs and services for the OLMCs in Quebec. That's our outcome. And we see that there's 5 ways to improve that. One of them is mobilizing the community. Another is to educate and sensitize the early childhood sector so that they understand the needs of the English-speaking clientele better, and supporting those educators to improve their role. Actually developing and offering better English-speaking services to the community, and adapting existing services. That's also something that's really important, is being able to help existing service providers adapt so that they can better engage the English-speaking children in their programming, developing and actually helping community organizations and groups develop services for the English-speaking children, and of course doing the research that's needed to promote the development of those services. So we're talking to, Minister of the Families. We're talking to ESDC, the federal department for that looks at early learning and childcare, and we're promoting, this approach to improving early childhood services for the English-speaking community. And I have to say that, with the evidence base and with the approach and with the support of the communities themselves, things are looking good. I can't say that we've had perfect success yet, but things are looking good. So my last piece, the last piece of research or evidence base that I'm going to talk about, links a lot to what Eva was presenting early in her presentation. This is an initiative to improve access to health and social services for those individuals that are having to travel interregionally for specialized services in the eastern part of Quebec. The foundation that is I'm connected to, or I'm executive director of as well, has a patient navigator project, and we, in order to build the evidence base that's necessary to support and get long-term support for this type of activity, we did a very extensive evaluation of the project. And that evaluation is providing some of the evidence that's needed to, go after additional funding to ensure long-term security of the project, et cetera. And so here I'm going to just give you some of the results of the evaluation. Of course, we're continuing to look at this as something that needs to be explored more. And the good news is that the success of this project and others is encouraging the development of patient navigator projects in other areas of the province. So Steve, my patient navigator, you see a picture of him there. Super Steve. He is our patient navigator in Quebec City, and he helps patients once they get the notice that they have to travel to Quebec City with basically four main things. Their travel logistics and getting help to and from the hospital from their lodging, because they always have to stay overnight when they travel this far. You have to keep in mind that some of these patients are traveling as far as if they were city to North Carolina. This is a huge territory that people are traveling from. I often describe it as to francophone partners that are trying to understand why we do this, is like, imagine that somebody told you, your doctor in Quebec City told you that you had to get in a car and drive to Boston and get all of your services in one of the major hospitals in Boston, because that's pretty much what happens to somebody from the Gaspé that has to drive or get themselves from the Gaspé to Quebec City. It's the same distance and the same reality in the sense of going from an English-speaking community. Is everybody there?
It just froze for.
Okay.
We just didn't hear the last piece. Like I didn't. The last sentence.
I don't know what happened, but my just blanked out there. I don't know if Zoom gave out on me.
So did you end your presentation?
No.
Oh, okay.
Okay. So can you see the slides? Yeah. Okay. Good. And unfortunately now I don't see the slides for some reason. It's very odd. Anyway,
We're back to your first slide.
I'm back to which slide?
Your first one, your title slide.
My title slide.
Yes.
Okay, that's
Jennifer. Does Jonathan have your slides handy? He can probably do a share screen if that's easier for you.
I think he does. I'm going to retry to share it again, but
no problem. I have them ready. If you prefer me to share them, just let me know.
Yeah, just go ahead. I don't know what happened, so I'm on slide 18.
Okay.
So, so Steve helps out with travel and logistics, as I mentioned, accompaniment, emotional support, of course, establishing English communications with healthcare providers, which means literally often the healthcare provider has not been made aware that they're having an English client coming to their offices, and often Steve goes in and makes sure that the patient is able to communicate with the nurse or doctor that they're working, that she's there to meet. And if they can't, then he tries to find the interpretation services that they need, although that is very difficult to do on the spot. As you can imagine, and advocacy on behalf of the English speaking patients. So he tries to make sure that they get information about their care when they go home in English, that they get consent forms. He's actually, making sure that their consent forms are in English and things like that. Okay, so next slide. And this is the very, least interesting, but at the same time, it's important. So we did a document review. We analyzed the administrative data that Steve collects. We did workshops with the project staff, so to make sure that they understood how to do the interviews and things like that. And then we interviewed 58 of the patients, healthcare providers in the regions and in Quebec City, the regional transport agents, the lodging managers, and the community organizations involved. And we had an excellent response rate. So next slide. And this is probably the most interesting to everyone. And the basic evidence that came out of the survey was that that patients got better access to the travel, healthcare, and medical information that they needed in English. It reduced their anxiety about traveling to Quebec City. Most of the people that travel to Quebec City are over 75. They're all in ill health. And often, and many times, the last time they came to Quebec City was 10 years ago, and they're completely unfamiliar with the city. So the anxiety level, as you can imagine, is pretty high. They had overall a better experience based on the fact that Steve helped them in the experience. And ultimately, they did get better access to English language services. The awareness of the staff in the institutions improved. And according to the interviewees, they believe they had a better health outcome. We can't measure that. It was more, just in a perception from the respondents, but they believed that their health outcomes was better. So, this is an ongoing analysis. We're going to continue to track all of our interactions with the patients and with the hospitals. And some of the things that didn't come up in the evaluation that are actually very interesting is that Steve is now being recognized by the PDG of the hospital in that he's bringing patients to. He's been asked to sit on committees around patient quality of service. He's contributing to the hospital's efforts to improve their capacity to receive English-speaking patients. So there's another element there that is not captured in the evaluation of the actual service. So those are the three elements or three pieces of research that I thought would be of interest to the people that are attending this conference. Of course, there's a lot more. The CHSSN's website is, you can switch to the next slide. The CHSN website is filled with community-based research, a lot of statistical analysis, and we also have quite a few frameworks that we've developed on particular issues that I think help in the understanding of the challenges facing the English-speaking community in different areas. For example, supporting seniors, supporting children in school, things like that. And so I encourage you to go to the website and look at some of the uh, information that's on the website. So I've gone over my time, and I'll call it quits there. But thank you. I look forward to answering questions. I saw some flying by, but we'll answer those at the end.
Thank you very much, Jennifer. So yes, we have questions that are popping up, and we're gonna, when that panel is done presenting, we're gonna go to the questions. So now it's my pleasure to introduce Professor Lorraine O'Donnell, and she is affiliate assistant professor in the School of Community and Public Affairs at Concordia University. She is the research associate for QScreen, and she'll tell us more about that, based at Concordia. A research focus on history and projects that enhance community well-being. And the title of her presentation is an introduction to Quebec English-speaking communities research network. So welcome, Lorraine.
Thanks so much, Carmen. I will share my screen now. Could you see that? Yes. Jennifer, no worries, because my presentation is quick, so we'll make up the time. I'm very pleased to have been invited today. It's nice because I know some of the people in the room, but I don't know a lot of you, and so it's a great opportunity for me to share with you a research network that might be of interest to some or many of you. Today, I'm going to present QuestGren, and sorry for the terrible acronym that gives everyone pause, Carmen. We pronounce it QuestGren, but I've heard many other versions.
Yes, I'm not sure how I pronounced it now.
It was perfect. Okay. It's the Quebec English-speaking communities research network. As Carmen mentioned, we're located at Concordia University, and QuestGren is a network of researchers, stakeholders, including, by the way, government and others, and educational and other institutions, that improves understanding of Quebec's English-speaking communities and promotes their vitality. Who we are. So QuestGren, as mentioned, is a network. So we are basically a network of different networks. We have a committee called the Interlevel Education Table, and some of the people in the room today have delegates to that table. We have an advisory board of 13 members. We staff at QuestGren are members of external research groups. And then we have what we call open members, which are our newsletter subscribers, which number up towards 800 people. And perhaps most relevant to today's discussion, we're at 63 actually, researcher members from Quebec, Canada, and abroad. And these are people who do research on all aspects of English-speaking Quebec. Internally, our Secretariat office, we have 2 principal investigators, 5 employees, including me, and we hire students as we go through each year. So I'll be telling you today about some of what QuestGren activities are and who some of the people in our networks are. With regards to our researcher members, as I mentioned, we have 63 members. So these are researchers from many institutions, as well as freelance and privately employed researchers who, if you look at that slide on the right under where it says areas of expertise, cover many, many different aspects of English-speaking Quebec, from arts to youth. And I circled or squared there in red topics that might be of interest to those of you studying health and social services. So these include health, poverty, social exclusion, psychology, rural and remote regions, seniors, social services, women, and youth. So if you go to the Questgren website and go to the researcher member area, you can click on those areas of expertise, which provides a filter so you can see which of the researchers do research on topics you're interested in. Why that may be of interest. First of all, if you're organizing conferences or activities, you might want to invite some of these people. Alternatively, if you're looking for someone to conduct research or be on a research team or project, you might want to approach these people. As you can see, the names there are in blue. Those are just the top 3. As I mentioned, there are 60 some people on the list. You can contact them through the information there, or always email me and I can give you some information. Questgren also organizes many events. We were founded in 2008, and at last count it was 64. We're edging up towards 70 now. And many of the videos from our events are online on our YouTube channel. On health and social services, Questgren has organized workshops and also sessions on the topic at our annual ACFAS conference. ACFAS is Association Francophone pour le Savoir. It's an annual large event where we do conferences within the large congress. So here's a sample event we did related to health and social services. It was called Services in English Speaking Quebec. Actually, the title has been cut off there. Santé et services sociaux dans le Québec d'expression anglaise. We carried that out in collaboration with CHSSA and with Jennifer, who just presented. We are open to other ideas for doing workshops and conferences with partners. For just as an example, we were able to work with Dialogue McGill for the current conference to share some of the knowledge we have in some of our networks and to promote activities. So we're very open to partnering with people in the room here today. We also do publications. So Questgren staff do research. Our researcher members also do research on English-speaking Quebec. Here are 2 that might be of interest to people in the room. One is by Richard Kestner and Anne Holding, and I know Richard is on the conference program for this conference. They did a very interesting study that was supported by Questgren called Did the Black Lives Matter Movement Help English-Speaking Black Young Adults in Quebec Recover from the Damaging Psychological Effects of the COVID-19 Pandemic? Another one of possible interest, so these are produced within Questgren, are a research brief we did on education on provision of services to special needs students. So kind of in line with what Jennifer was discussing about special needs, but in the education context. We produce a lot of research tools. We have a newsletter, and I'll be providing links at the end where you can subscribe. So our newsletter is where you can find out what we're doing and latest publications on all aspects of English-speaking Quebec. Facebook, we have an online bibliography listing publications. The numbers, even since I've produced this PowerPoint, have gone up. So it's over the number provided there. And we also have something called the Community Knowledge Open Library. And I'll be spending a moment or 2 to describe our bibliography and the open library. As mentioned, the online bibliography has, well, it's well above the number there, but somewhere around 14,000 publications on various topics related to English-speaking Quebec. And when I counted last, there were over 1,000 on different aspects of health and social services. So I'll show you what the bibliography interface looks like in a moment. but you can see the different subtopics here related to health and social services, including hospitals, personnel, the system, programs, etc. Within those, I did a search for the topic of access, which I know is of great interest to people here today, and there are 366 hits. So those are publications on the topic of access related to health and social services. I do want to say, though, that a number of the studies are historical in focus. So they may not be about today's issues, but issues in the past in some cases. This is what the bibliography interface looks like. On the left there, you can see refine by. So those are filters. You can do subject. So you could, if I had it live, which I don't, you could click on subject and then on health and social services, and then you'd get those subheadings that I mentioned here, the subtopics that would show down, and you could click on any one of those to see exactly what's being published on any of those areas. You can also do a simple word search or author search in the search bar at the top, the horizontal line. And then what you do is you get a list of publications. So you can print the list out, or you can click on any of those references to get more information about the publication. But just to repeat, this is a bibliography. The publication itself is not contained, it is listed. If you want to find the publication and it's not available at your library, you can contact me and I can try to dig it up for you via interlibrary loan. We also have another tool, a more recent one, currently in development. It's called Community Knowledge Open Library, or CKOL. It is like our bibliography, but it not only lists resources, it provides them in PDF form. The resources listed and provided are not commercially published materials, which is what our bibliography is mostly dedicated to. By commercially published, I mean published by a publication house with an ISBN and so on. These are what librarians call gray literature. So they're reports, newsletters, PowerPoints, annual reports, and so on. So not formally published material, but they're materials produced by English-speaking Quebec community groups for the most part, and some individuals, including some of the people in the room today. And as mentioned, the fully searchable PDFs are available through this tool. So there's the interface. You would recognize it. It's quite a bit like our bibliography because it's produced by the same service provider. You can see on the left the subject headings. I clicked on health, and where the arrow is are the subheadings related to health for which the CKOL database has materials. So here we see at the time there were 158 resources. If you look where it says results, excuse me, related to health. And if you click on any of those resources listed, you can click another button to actually see the full PDF. And for your information, the entire PDF is searchable within the search bar. Oh, I didn't mention it there. We have over 25 partners contributing material to CKOL, and one of them is CHSSN. So CHSSN's reports will not only be available on their own website, but also through this tool. And as I mentioned, they will be fully searchable and easily accessed. So QuestGrant is clearly a source for knowledge and expertise on English-speaking Quebec health and social services, including the access issue. And I invite you to engage with QuestGren. So please consider subscribing to our mailing list, and that's how you'll hear about new publications, research projects, and other information, conferences, and so on related to English-speaking Quebec research. You're welcome to attend our events, to be a partner with the Community Knowledge Open Library. If your institution produces reports, PowerPoints, and so on that you would like to have available in that central clearinghouse. And if you're a researcher doing work on English-speaking Quebec, you can join our researcher member group. And information on all of these ways to engage with QuestGren is indicated on our website, questgren.ca. Thank you very much.
Thank you very much, Lauren. And I've been able to practice my saying your acronym while you were presenting. I think I got it right now, but I won't even try.
Great, thank you.
Thank you, thank you. So our last presenter is Richard Walling, last presenter for this symposium, obviously. And Richard Walling is Executive Director of the Jeffrey Hall Community Partners. His career focus has been on the development of health and social services for the English-speaking minority community in the Quebec City region. He's also Executive Secretary of the Governors of Jeffrey Hall, St. Bridget's, a public health and social service establishment in Quebec City. The title of his presentation today is Aging in Community, an action research initiative focusing on English-speaking seniors in the Quebec City region. So welcome, Richard.
Thank you very much, Carmen. I will just share my screen for my presentation. And can everybody see that?
Yeah,
absolutely. Thank you. First of all, what I want to share with you today is a partnership that we are presently in the process to developing to help support between three organizations. So the three organizations at the heart of this are Jeffrey Hall St. Bridget's, which is a public institution in Quebec City, which is designated. So it provides English, all of its services in English and French. And it has a rich history. Both are over 150 years old and really are probably the most or some of the most visible names and institutions of the English-speaking community historically in the Quebec City region. And Jeffrey Hall St. Bridget's has a wide range of services, everything from frontline CLSC services available in English, all the way to long-term care and palliative care. So it is very involved and really many members of the English-speaking community come through Jeffrey Hall throughout different periods in their lives. Jeffrey Hall Community Partners is a nonprofit charitable organization which actually works very closely with Jeffrey Hall St. Bridget's. You'll see we share the same branding and the same logos, and we actually share the same physical spaces. But we are sort of that community angle of Jeffrey Hall St. Bridget's. So what the public system can't provide through the community sector, we provide. And we have another partner, which is very active in the community called Voice of English Speaking Quebec, which is more of a generous organization. And you'll see the role that they play in the partnership. Historically, Jeffrey Hall Community Partners, Jeffrey Hall St. Bridget's, Voice of English Speaking Quebec, and many others, we've always worked to develop services collectively and basically using a knowledge base. So things that Jennifer referred to in terms of the studies. When I go back to Jeffrey Hall Community Partners, it was actually created in 1991 out of a knowledge-based approach, looking at the needs of seniors. So while Jeffrey Hall Community Partners offers a wide range of services to all age groups, what I'm going to focus on right now is a particular initiative, which is more of a research action type initiative, where what we want to do is address the specific challenge or gap in services in our community. So the English-speaking community of Quebec City numbers about 15,000 people. It's fairly concentrated in the Quebec City region, but there are more rural pockets in Port-Neuf, in Shannon, Valcartier, but they tend to be within a 30 to 40 kilometer radius. If we look at what we're focusing on here is our target population here is seniors for this specific initiative. And what we are looking at is how can we continue as a partnership of these three organizations with other partners in the community to promote healthy aging among seniors. And the definition we're using to sort of guide us is that of the World Health Organization, which basically says it's a process of developing and maintaining the functional ability that enables well-being in older age. This includes a person's ability to meet their basic needs, to learn, grow, and make decisions, be mobile, build and maintain relationships, and contribute to society. Now, our target population for this specific approach in our aging community is really, we have a pyramid. So at the bottom of the pyramid, we have autonomous seniors living at home. For all intents and purposes, these are people who, you know, are doing all their daily living needs. They're doing their groceries, they're maintaining their home. And they tend to be the clientele right now of the organization called Voice of English Speaking Quebec in our partnership. And they have a project which is out and about. And what VEC is trying to do with this population is make sure they remain connected. And they're very involved in doing social activities, cultural activities, those things. Now, at the top of the pyramid, you have seniors living in long-term care. So this is our seniors in our community who, for example, are actually living at St. Bridget's Home or Jeffrey Hill. And there, they are really well taken care of because they are within a long-term care facility. There is a lot of community support around them. But our target population right now for this approach is those two segments that are between that. So seniors receiving support in adapted living. So those are people, for example, who are starting to receive support, and it could be and seniors living at home with support services. So those could be people who require long-term home care services, those who require specialized housing. For example, we have in our community McGill Manor, which is for autonomous seniors, but require a support environment. And our whole objective is really how can we focus our energies as a community to make sure those people can stay in their homes with the adapted services as long as possible. So what we did is we started defining the aging, the population as basically not only the seniors, but what we call their allies. And so it's not just looking at the senior in isolation, it's looking at who is around them, who are their families, who are their caregivers, who are their friends, who are their neighbors. We also include the groups that they may actively involved in, because we think they are all part of the process, or part of the what's necessary to ensure that healthy aging. So what we've done is over the last year, working with a McConnell Foundation and a program called InnoWeave, we started to define what we call is the theory of change. Now, I know you can't read this, but basically, well, you can read parts of it, but basically is what's our target population? Our ultimate outcome we've defined is that by 2026, we can significantly increase the number of English-speaking seniors who are able to benefit from healthy aging in the Capitale Nationale region. And we are going to do that by focusing on three outcomes. So those three outcomes are increased connectedness, improved access, and reduced stress. So what does that mean? So increased connectedness, or what we call increased awareness here, is really to what extent are seniors connected to the community? What networks are they part of that, whether they're formal networks or informal networks? So are they aware, are they connected? Increased access is really, can they access the service that they need in a timely fashion? So the person who is starting to show decline or a loss of autonomy in their home and starts to need home care, are they able to get that service again in an not only access it, but in a way that is accessible to them? And the reduced stress is another element that's also very key for us here, because the reduced stress is really, how are we going to measure once we know awareness, once we know what their access is? What we want to be able to do is reduce the stress that both seniors and their allies face as people transition through various phases of loss of autonomy. And right now that stress is very high. Access for certain services is good, but for other services like home care is not very good. And although we have McGreevy Manor for seniors who need more of a secure environment, it's just one facility of many, or one type of service that what we need. So this is really what we want to change. Now, what's of interest here is it's a knowledge-based approach to making this change happen. So here is where what we are doing, and this is where we are year one, and we started the process, is we want to create the baseline. So the baseline for us is really gathering the knowledge base that we need to do to understand what's our starting point, so that we can measure our evolution over time and know where we're going to be in 2026, and are we on the way to achieving our objectives. So the way we're doing that is obviously updating our qualitative database. So there's the Stats Canada that will come in, which will tell us, the percentage of seniors and where they're at. And there's also the Geodata project, and Jan Warnke, I saw, is one of the participants. He's the one who's doing the Geodata project with us, which really is an innovative way of layering different levels of information and being able to identify not only, for example, where our seniors are geographically, but also which ones of them are actually using our services and what type of services are they using. And are there gaps? Are there seniors within our area, for example, that we're not accessing? So that targets right away into, are they aware? And are there geographic areas where we have to do more outreach? Besides the quantitative data, what we are going to be doing is building qualitative data. So what we want to know is around what are people's awareness, what are people's sense of access, and what are people's experience in terms of stress. So we started focus groups. Our first focus group took place 2 weeks ago, and that was with the key interveners, with the core partners. So these were the workers at Jeffrey Hale St. Bridget's, at Jeffrey Hale Community Partners, and at VEC, for example, who are on the front line with daily contact with the seniors to understand their experience around awareness, access, and stress. Our next will be key interveners, and that's expanded partners. So that will involve other organizations such as church groups in our community, seniors, old age clubs, those type of things where seniors may be involved. And then the third target group that we will do a focus group in the spring will be with seniors and their caregivers. And so there's focus groups, interviews, and surveys. So in year two, based on the data that we're going to get from year one, what we will do as a partnership of those three organizations, so Jeffrey Hale St. Bridget's, Jeffrey Hale Community Partners, and A Voice of English Speaking Quebec, is pilot 2 or 3 initiatives that we think will help meet our 3 objectives around awareness, access, and stress, reducing stress. So here's where we actually get an awareness of what is actually there, what is the experience of our seniors and their allies, and we, by year 2, will actually start seeing what is the action that we have to take to try and increase the awareness, increase access, and reduce stress. So Throughout the process, there's a formative evaluation process. So Jeffrey Health St. Bridget's and Jeffrey Health Community Partners are also the key organizations involved in what we call the Centre d'Expertise Access, which is attached to the CIUS Capitale Nationale and focused on access to English language frontline services. So we're working with them to build a formative evaluation process to inform both the process and measure the impact. So that is a process that is currently underway. We are doing this organization, obviously not together. We have a couple of consultants, McKay and Company, CES sur C, and InnoWave. Those are all partners that are involved with us in terms of developing the theory of change and supporting us with coaching and mentoring along the process, and the Center of Expertise. So the purpose today was just to share with you a process that's underway that is based on a knowledge-based approach, and hopefully will improve access to services for seniors in our community in the years to come. Thank you.
Thank you very much, Richard. Very important project, as we know there are so many unmet needs in this particular aging population, so very appreciated. So now I'm looking at all of the questions that were put to the panel. Some of them were already answered, so making my job in a way easier and more difficult. So should I kind of pick some questions that I see or comments that I think have not been addressed? So Jennifer, Michelle Hogg says that you mentioned the need for dads, fathers to have access to specific measures and activities. Hence, Four Corners will have a dad Let's Play Saturday morning program starting, I guess, in 2022. So great support and collaboration is offered by RVP in this initiative. So and the link is in the chat. Michelle, anything to add, or if you want to come on and just otherwise we'll just move to the next question or comment. I'll give it a few. Nothing to add, I guess.
Well, I'll just add that there is an interesting positive progress in terms of addressing men's particular needs. I'd say an important improvement in the awareness of the fact that men need a special approach, and that groups are actually looking at it that way.
Great. So I've noticed that Dialogue McGill team has been very active in sharing links. Jacqueline Vachon has shared links for, now I'm going to have to say it right, Quest Screen. So Jonathan also Caballero has shared links to Concordia. More information on CHSS, and the link is in the chat. Also Jeffrey Hale links. And I think there was a comment that about the notion of professional interpreters versus lay interpreters by Terry Kaufman that was answered by Jennifer. Jennifer, do you want just to maybe capture the comment and your response?
It's really important because it does resonate with Sarah Bowen's presentation yesterday, in that the role that a patient navigator can play can be very different. Our patient navigator is not a qualified translator, so he cannot do translation for a patient. But there are examples, and I believe there's some people here from the Sept-Îles area where you do have a qualified translator that's doing patient navigation in the hospital, and they accompany the patient to their appointments. So there's a wide variety of how patient navigation is done. And in our case, the translation is not is not a part of the role of the patient navigator. He's more an advocate for the patient to receive services in English.
Thank you for the clarification. And also Lise Richard talks about promoting the view that Sarah Bowen presented yesterday of bilingual health professionals and interpretation. And then she comments on equity in service is the main reason, not to mention the extra time needed by health professionals to include an interpreter, especially in regions where the French-speaking population is significant. So Lise, if you want to intervene now to talk a little bit more about your comment.
Sure. I was mostly commenting on Terry's comment. We've worked quite closely with Sarah Bowen, and we certainly came to the conclusion that we prefer seeing bilingual resources in areas where there are francophone minority populations, for the reasons that I cited there, and also to ensure a certain quality of service and to bring organizations to really think about what it takes to organize services around a bilingual environment in consideration of the patient needs. So I think it's an important point, and Jennifer also brought an important point that it's not the role of the navigator to do interpretation, and there is much research done by Sarah Bowen around the reasons around that.
Thank you very much. Helpful, yes. Thank you.
And I would just add to that there is a really interesting bank of interpreters available in the province of Quebec, but they're just not. It hasn't become a reflex yet. So that's another thing that we try to encourage health professionals that and unfortunately they had to be organized in advance. They can't be organized on the spot. So or it's difficult to organize them on the spot. So that's another avenue.
And given the presentation of Eva earlier on, I think there's a place here maybe to discuss that with coalition and with advocacy groups to see how are they addressing the need for professional translation at times and bilingual materials. So for sure, I think there's going to be more collaboration across presenters, and so this is great. Lorraine O'Donnell said that she'd be interested in hearing from Jennifer and Richard and people in the room about barriers they see to stakeholders, such as people working in community groups, accessing and making use of research. So Lorraine, are you talking about barriers for researchers to access resources? Do you want to come on and just maybe clarify? Me not understanding clearly what you. Yes.
Yeah, Carmen, thanks for asking for that. What I hear on the ground, but I'd love to hear from Jennifer and Richard or people in the room, is that there's sometimes a bottleneck. So we know that research is available. They can see, on our bibliography, a list of what's published. They can go to CHSSN and find actual publications. My question is, are there challenges for people in actually making sense of what they read or knowing how to apply what they understand from what they read? I don't mean people have cognitive issues. I mean, is the research presented in such a way that people can apply it in a useful way in their day-to-day work?
So there seems to be a real role for the dissemination and translation of knowledge. And I think for sure, sometimes presenting it with its strength, the new knowledge with its strengths, but also its limitation is really important. So I wonder if the panel wants to further.
Maybe I can take a shot. And and experience that we've had over the years is the research is there. It often takes organizations, for example, in our case, either Jeffrey Health St. Bridget's or Jeffrey Health Community Partners, to actually bring the research to a public partner and frame it in a way that they can see how they can act upon it. They won't necessarily do it themselves. So I think the community, through its different organizations and networks, oftentimes finds itself as not only helping interpret, but it has to almost bring the research to make the awareness of that level with the partners, and not only public partners, like in our region, whether it's Suicide Prevention Center or those type of things, but also help them understand, because they'll look at it and say, oh, but for small minority communities, they'll have no sense of what can we do to actually address it. So we not only have to bring the research, but then try and partner with them to find a way to act upon that research. So I think we act as in many ways, not only a bridge, but reframing it in a way that's actionable for them, and then following up, because the reality is, as we say, in Quebec City, we're 2% of the population. The people at the CS don't get up every morning trying to think of how they can better serve the English-speaking community. So we do that, but we have to constantly bring it to them. And that research component, that knowledge-based approach is so, so important. But how do we dissect it in a way that's then usable?
Mm-hmm. Yes, very true. And in fact, Tim Carter suggests the knowledge broker as an important role, and Lorraine pushes it to maybe knowledge navigator. So there are interesting suggestions here. Thank you.
And I just want to add to that, because the next step down is how do we ensure that, you know, a regional organization knows about the research that's being done. And I think that that's also one of the bottlenecks with regards to I mean, even me, I mean, I struggle to know what's going on, you know, in the research community. Now, you know, there's QuestCren that I think people are not using adequately, because QuestCren really is becoming, you know, a repository of research on the English-speaking community. And I encourage everybody to, you know, use it for that capacity. But also, I'm working with at the federal level with Health Canada, and Carmen, you're involved in that initiative too, to look at ways that the knowledge sharing can be facilitated and disseminated better. And I don't think we're there yet 100%, but we're making strides to do that. And events like this are super important. And you know, I think you know, we just need to put it as part of one of the things we do.
Very true. And in fact, Eva Villalba is commenting that, to Richard's point, researchers and advocates can be stronger and have more of an impact when they work together. So I think she's bringing that aspect too of the advocacy and that collaboration with researchers. Let's see, I'm trying to... Brigitte Paquette, la recherche-action permet de soutenir l'adaptation des services.
Brigitte Paquette, action allows to let people to get to know through know-how.
Between participants in the research and the researchers and the decision makers. Nathalie Boivin comments that la mobilisation des connaissances, le rapprochement.
Mobilization, knowledge, and the connection between the producer and knowledge remains a challenge. Often the texts are too long, the terminology that is used. So she's suggesting, can we innovate, and can I have my research in 180 seconds?
You know, in the past 15, 20 years, we used to do these documentaries where we thought that something that's 20 minutes long, it would be just appropriate. And now we're talking about, can it be 30 seconds, a minute? And so how do we adjust for the explosion of information, and how do we make it palatable so that people actually attend to that information? So a very good point here. Let's see if there's anything that I guess, Nathalie, une excellente idée, this 180 second.
Great idea, this 180 second.
And then she adds, songez à la façon dont les gens s'informent.
Think of the way that people get information.
Information is now accessed on social media, and how can we adjust our messages to that reality of very quick consumption or consommation d'information. So we're almost 1 minute left, actually, and we're doing something that I find quite interesting and innovative next. So thank you, the panel. That was lovely. We got great participation from people in the audience.